Councilman Gilmore.
Good, good to see you. Yeah, just of the health and hospitals, yeah. Who do you have with you? Dr. Paul? Okay, I don't think I've ever met him, okay. It is.
Ready to go?
Good afternoon. I am Erica Gilmore, the Chair of Health, Hospital, and Social Services. We will now begin the meeting for the Department of Health. We have with us Dr. Paul, who is our Director of Health. We also have Mr. Peter Fontaine, who is the Director of Administration and Finance Bureau. We're happy to have you today, and so we'll let you open with your remarks.
Thank you, Madam Chair. Good afternoon, everyone. I'm Dr. Bill Paul, Director of the Metro Public Health Department. It's an honor to lead the department. Our mission is to protect, improve, and sustain health and well-being for all people in metropolitan Nashville. It's a very large mission, and it's a pretty large department. We have 500 staff that have a wide variety of skill sets, wide variety of things that we do in order to carry out our mission. And then the added dimension to what we do is that our mission is not something that we can do entirely alone. So part of what we really need to do in the community is develop partnerships, develop systems, and help Nashville become a healthier place. In a way, it's like I'm a doctor with a patient, and my patient is Nashville. And so certainly the department has a lot of different resources to apply, but then we also need to work with people in the community to make Nashville a healthier place. I'm happy to talk about the mayor's recommended budget for next year. We have a few improvements that we're looking forward to implementing with your approval. One is an expansion of our oral health program. We have a phenomenal preventive oral health program in the schools. And what we have is 1.5 FTEs that will enable us to expand our services to a younger age range with the WIC customers that come to see us and do fluoride varnishes, dental exams, and dental care as needed for that population. This is potentially a big impact on prevention of cavities, prevention of really terrible things that happen to kids at a young age because of oral disease. The other improvement is an opiate prevention or opioid prevention position. We've started a task force within the health department, and we've started to reach out across metropolitan government to work on systems for preventing opioid-related deaths. As you have seen across the country, across the state, and certainly in Davidson County, we've had an increase in overdose deaths related to opioids, prescription opioids, and then in the last few years, non-prescription opioids. Heroin has come to Nashville with a vengeance, and I believe last year we had over 80 deaths that were heroin related, and that's more deaths than we have from traffic accidents or from homicides. And so we need to be very focused on assessing what's going on, where it's going on, developing systems and policies, and then intervening to prevent these deaths, and even go upstream from that and work on the issues related to addiction. The other thing just to mention in the mayor's recommendation is related to a public investment plan. The Community Mental Health Systems Improvement Group, which we convened over the last year, developed a proposal which the mayor's recommended funding, and that's $427,000 Largely, that is going to be targeted to the mental health co-op for crisis services as part of an effort to steer people towards treatment and away from punishment. That is, pre-arrest diversion and hopefully fewer mentally ill people in jail. It's not the complete answer to decriminalization of mental illness, but it is one really crucial piece. We're excited because that funding, if you, again, approve it, we'll be able to go together with funding that was in the governor's budget for pre-arrest diversion infrastructure, and so we'll be able to build some pieces in Nashville that will help the system work better. I'm happy to talk about anything in the health department that you'd like to discuss, requests that we made and were not recommended, but really anything that we do, and I appreciate your commitment to public health. So thank you, Madam Chair.
Thank you, Dr. Paul. We appreciate you. We're going to go with Councilmember Russ Pulley. He's the first. Then after that, we will call on Councilmember Weiner, who follows him after that in the queue.
Thank you very much, Madam Chair, and thank you for appearing before us, Dr. Paul. Just a couple of quick questions. One, just talk a little bit about your opioid program and how your administrative assistant position is going to impact the overall opioid overdose situation.
Yeah, this is not the kind of thing that we're going to be able to do by ourselves in the health department, and one person is going to basically help us connect the dots on a variety of things that we need to do. We're right now in the middle of trying to do an assessment on overdose deaths and monitoring overdoses in Nashville. And so one thing that many communities are doing and that we'll want to make sure is in place is increasing access to naloxone, the antidote for people who are in the middle of overdosing. And it's important to do that in a targeted way. But that's one step, and it is fairly late down the road of overdose, but it's something that we want to make sure that's in place. Otherwise, it's coordinating with various entities that interact and help service organizations that will interact with people with addiction, trying to identify gaps in treatment and mobilize resources for drug treatment. Working with the state has done extensive work on prescribing practices, and that is something that really fits with statewide licensing and the Controlled Substance Monitoring Database, but identifying really what we can do locally to help people avoid becoming addicted to prescription opiates in the first place. So it'll be a variety of activities from primary prevention of addiction to prevention and mitigation of overdose.
I'm sorry we have such a problem to deal with, but thank you so much for your efforts in that arena. I'd move to the other expenses category where we see a 7% increase. I'm just curious what that represents.
7% increase in other expenses.
$87,000. Slightly less than 6.76.
Okay, so yes, I missed one. There is a software expense at Metro Animal Care and Control, and so we're upgrading software at Animal Care and Control to allow use of basically an online mechanism for support of licensing, and so that expense is also tracking with a license fee increase that's tracking in the budget. That's the main piece of that.
Okay, thank you. And I just want to give you an opportunity to comment. I know the fees are increasing in the revenue department, and I just want to give you an opportunity to comment on the need for that and why they are increasing as they are.
Yes, I mean, as I just mentioned, for animal control, the rabies tags, that revenue is really largely to support the software upgrade that we're doing, and part of that is also to better support the idea of a 3-year rabies vaccine, because there's a lot of people who don't want to have to go to the veterinarian every year for a tag if what they've got is a vaccine that lasts 3 years. So part of the solution is this software upgrade and a change in how we're dealing with animal licenses. Otherwise, the more restaurants there are, the more fees we collect, and the more restaurants there are, the more work there is to do. And so last year you approved an increase in staff for inspections. That is holding us okay at this time. But that would be another reason for more fees to be coming in.
Good. My last question deals with the special purpose fund, and it saw a pretty significant decrease in both expenses and revenue. I just wondered if you'd comment on that.
Okay. Yes. So there are some grants that have basically gone away or reduced, and I can list some of them. The WIC grant has decreased significantly, and that's what's the word I want? The demand, the number of customers has gone down, and the state has kind of reset how they're allocating WIC dollars. Otherwise, there are some other state grants. The tobacco settlement grant is one where we're working on tobacco prevention, and that's one where our next year's allocation will be lower. So it's a variety of grants where the funding to us is decreasing somewhat.
Okay, thank you. I have nothing further, Madam Chair.
Thank you, Councilmember Pulley. Next, we have Councilmember Weiner in the queue.
Thank you, Chair. I appreciate it, and thank you, Dr. Paul, for being here today. I have 3 questions. Question number 1 will relate to the expenses that the licensing fees that we've been addressing here just a few minutes ago. So collectively, do our licensure fees cover our expenses as it relates to those fees in those areas? Or are we still behind?
Yeah, it depends on the area somewhat. Certainly for food and public facility licenses, the fee is pretty much set to cover the cost of the program. There's not a separate, I mean, certainly it appears as an appropriation, but it is covered by revenue from the fees. Animal control, no, the fee doesn't cover all of the public investment in animal care and control. And even with the increase, that's really just funding a relatively modest increase in the program budget.
Okay.
There are probably other fees. I'm trying to think of what they are off the top of my head, but those are the biggest chunks of fee revenue for us.
Right. Could either you or Mr. Sharp or somebody get us some information as to how much in the hole these departments are relative to the fees? We may just need to get creative at some point. I don't know how we're going to do that, but I think it's worthy of taking a look at.
Yeah, we can. We'll take a deeper look at that. I mean, I think part of what our animal control service is a public safety function, and
Right.
And so it is quite a gap between what we charge an individual animal owner and what it would take to have the individual animal owner licenses pay for all of our operation. So.
Yeah, having owned 3 of my own, I'm really not excited about that fee going up. However, I still think we need to take a look at it. So that was question number 1. Question number 2, apparently school nurses have been cut from the Metro Schools budget because they didn't get the allocation seemingly at this point that they wanted to cover that expense. Is there a mechanism for the health department to help facilitate the placement of some school nurses in some of the bigger programs that may absolutely need it?
So, yes, you're referring to, again, a project or a planned expansion of school nurses that we've been working on with Metro Schools for a couple of years. And this was, again, in the public investment planning process. And I think everybody would like to see the expansion of school nurses, with the standard being about 1 nurse per 750 students. We are about half of that right now. And as it played out in the school's budget, the school board was not able to prioritize the expansion. So what we had in there, or they had in there originally, was I think 900-something thousand for year 1 of a 3-year phase-in of the level of nursing that we would expect to be really helpful and a minimum to do what a school nurse program should be doing in the schools. So yes, we're hopeful. We're ever hopeful to expand the nurses and get the nurses to where they need to be. Your question is whether the health department has capacity to add by ourselves, or
No.
okay.
Is there a way that the health department can work into their budget a way to help facilitate some measurable increase in that? Do you have any room in your budget to do that? I know, you can laugh, but I have to ask.
It's all a matter of priorities. So certainly we have nurses, and our nurses have jobs, and we have not identified entire clinical operations that we want to. We would rather not do to support school nurses. So I don't feel like we've got the room in our budget to make a significant impact at this point.
Okay, we'll get back to that. We'll talk about that offline.
Sure.
Third, what is the status of the audiology program? Did you hire an audiologist, and has that program expanded to do the things that it has the potential of doing?
This is a vision that has been unrealized, and it has been a very frustrating story through the year. We have interviewed lots of audiologists. We have offered and had 3 different audiologists accept a position with us and then withdraw. And so at this point, we have been unable to fill the position. And so we're going to try to get as creative as we can to make audiology services available within our site, but using our conventional position, full-time position, even a half-time position, and hiring on the market for an audiologist, we have not succeeded yet.
I know there are audiologists in the community that do consulting for various physicians and other groups, and that may be a direction you want to look at, or maybe through the university system, because the audiologists have to get clock hours. And
Right.
so that would be a great opportunity to give them some off-site experience with supervision.
Excellent. Yes, we were talking about this week. It's like we need to try a different way of doing this.
Well, I'm happy to help give you some names and get you in touch with some people, because it's such a valuable tool.
Yeah. Thank you.
Well, that's all I've got. Thank you, Chair.
Thank you, Council Member. I did see Council Member Cooper. No questions? Hold on just one second. There you go.
Thank you, Madam Chairman. I guess, a quick follow-up to Council Lady Wiener's question. Would our neighboring counties have a better nurse ratio than we do? Would you think, is this sort of standard of 1/750, is that a national standard where we're only half that?
It's a standard that some states and localities have committed to fund. I don't know about our immediate neighboring counties. I believe that maybe one of our counties that's more affluent might be there.
They might, okay.
But across Tennessee, I don't know that that there's a lot of examples. Certainly, Charlotte, North Carolina decided they were going to go for it, and they've implemented, and there are a number of other places around the country that have gone for that model. So it's the Centers for Disease Control and the American Academy of Pediatrics. And there's some studies. We can share a consultant's report that we had developed to really kind of make the case for what the return on investment is. And some of the return on investment really is that the educators can go back to educating and not attending to bloody noses and bruised knees and runny noses and those kinds of things. And then some of it is for parents, too, that don't have to drop everything in the middle of the day to come get a child who might not be that seriously ill. So there's a lot of payoffs in the schools, both in terms of their operation, but also in terms of getting barriers to success, the health-related barriers, off the table for those kids.
Thank you.
Thank you, Mr. Cooper. Councilmember Hurt.
Thank you, Madam Chair, and thank you, Dr. Paul. And I may not have my question right, but I've been concerned. I had some people question me about needles and hepatitis C, and I didn't know if that was a mandatory thing of changing out needles because of how prevalent hepatitis C is in the community these days.
It's a good point. Hepatitis C is certainly out there, and the good news is that hepatitis C, there's really excellent, successful drug therapy for people with hepatitis C now. So it's important for people who might be at risk to get tested and then hopefully to have coverage to be able to be treated to prevent long-term liver disease. It is transmitted through blood and body fluids, mainly blood, and so needle sharing is a big risk. And so one of the things, both because we're starting to see more heroin being used, but also just because of the prevalence of hepatitis C in the community, the importance of people not reusing or sharing needles if they're in a situation where their addiction has driven them to self-inject.
Well, seeing no more people in the queue or council members in the queue, we'd like to thank you, Dr. Paul, for being with us today, and Mr. Peter Fontaine, who is your CFO. We appreciate you being here as well, and we appreciate Mr. Sharp, who comes to our committee meetings and articulates those bills so wonderfully for us. And also, I would like to thank Councilmember Cooper for giving me the opportunity to chair this particular committee. This closed this particular budget hearing. Thank you.
Thank you.